Hello, and welcome to the Clinical Care Options Infectious Disease Podcast. I'm your host, Jennifer Blanchette. Today's episode is part of an ongoing series on addressing key challenges in the management of viral hepatitis. This series features conversations between a patient and a clinician where they discuss challenges and barriers to treatment and care for patients with hepatitis and ways to overcome those challenges. In this episode, Dr. Oluwaseun Falade-Nwulia from Johns Hopkins University School of Medicine talks with Alicia. Alicia was diagnosed with hepatitis C when she sought treatment for substance use disorder. She talks here about the barriers to HCV care that persist for individuals with a history of injection drug use, as well as for other marginalized populations. For more information about our guests and for additional online education on this topic, please visit the link in the show notes. So now let's turn it over to Alicia and Sean.
Thank you so much for being willing to share your experiences with us. I want us to start our discussion with you telling me a little bit about how it felt and what your experience was with getting diagnosed with hepatitis C.
So when I was diagnosed with hepatitis C, I was very young. I went into treatment around the age of 18, and they came back to me and told me that I was positive for hepatitis C. I had very little education of what hep C was and what that meant. And then I made a phone call to my mother and explained to her that I had hep C. And she had shared to me basically how she shared it. It was like, oh, it's no big deal. I have it too. And I was like, wow, then, I must have contracted it from her, because at that time I was an IV drug user and I used with my mother. And I was just amazed that I never knew this about her, right? That she never thought to share it to me. And when I was exposed to it, I was like, okay. So I was just shocked. And then, at that time, I still wasn't educated on it and what it meant, right? It's just that, it was in my blood system, and, they didn't talk about treatment at that time with me and what I could do. Basically, they just told me that I had hepatitis C in this treatment facility. At that time, then I talked to my dad about it. This is the education that I was receiving, not through medical or that treatment facility. And I remember my dad, because he was incarcerated, and he told me that he was receiving interferon shots because he had hepatitis, and that he was very ill. He was actually in the infirmary of the prison because of the side effects of that medicine. And my feelings was like, oh my gosh, that's horrible. I'm going to have to go through this. And I feel real bad. It's like chemo treatment, basically how he explained it. And it kind of put some fear into me. So I continued on living with hepatitis for a very, not for a very long time, but I continued to live with it. And then I came to treatment, inpatient treatment in 2015. Is when I began my journey of sobriety. And I remember, going back into the field, working at that treatment center and moving over to behavioral health and, sitting in trainings and learning about hepatitis and that there's a medicine out there that cures it, because I'm now in this field and I'm learning about it. And, I talked to one of the nurses at the health department, and I was like, I want to try to get treatment for this, me living with hepatitis. So my experiences was that, I called the doctor and I went and got labs. And when I went in there, of course I explained that I had used substances and that I'm in recovery. I told him the details. And then he came back to me and told me that my liver enzymes was not high enough, that I had no damage to my liver. Therefore, that I wouldn't qualify to, the insurance would not pay for the medicine. So then I'm like devastated, because, I'm like, there's medicine out here I'm probably never going to go into liver failure because I live a different way of life and I'm not doing damage to my liver anymore. And I was very upset. So I went back to the health department, and this time I spoke to the doctor over at the health department. And she said, well, I know a lady, and I'm going to give you her number. And I was like, I'm tired of going through the blood work. Yeah, I'm tired of being told that I'm not qualified. And she was like, I think they have a program that will be able to help you. And I called this lady, and she's like, let me order you some labs. I talked to her, and I was like, oh, God, here we go with the labs again. And we went to the labs, and then I drove out to do a telehealth appointment. Very sweet. I loved the engagement. It was definitely a different experience than the first doctor I met. He was just kind of brushed me off. And this lady that I talked to on the screen, when I told her about my recovery and where I'm at, the engagement and the excitement and the expressions and the conversation I had with her, she's just all for people, to help people, whether they use substances or not, or no matter how they contracted it. She had a big passion on treating and curing people. And I felt that. I felt that over a telehealth appointment. They were so willing to help me. It was a very easy process. I was driving. Work full time. I have 2 kids. They worked around my schedule and what best fit me. I had no problem. They said that they would fight with the insurance company, and I'd just sit back and wait for the call. And I got the call, and I was approved for my medicine. And I knew I was not going to miss my dose after everything that I went through to get this medicine. And I'm someone that does not take medicine on a regular, but I made sure that I followed the direct orders because it was such a challenge to get Hep C treatment that I did not want to ever go through the barriers that I went through in the beginning to receive, the treatment that I really wanted. And again, even with COVID hitting a couple years back, I'm like, oh my goodness, everything's shutting down. I was still able to do my telehealth through my phone on quarantine when we all got mandated to stay in our houses and got my cure results. And it was the best feeling ever at a time like that. So, yeah.
Thank you. Thank you for sharing that. And listening to you, one of the things I heard was that when you got diagnosed, all the information you got was from family, right? And really did not get much information from the drug treatment center where you got tested and diagnosed. What do you think could have been done differently, or what do you wish had been done differently at that time?
When you are reading off someone's lab results and you have to, tell them that they are positive for hepatitis C, if I was in that position giving someone their test results, I would tell them that they've been exposed, then, explain what that was and what that meant. And then I will also provide them with resources. I wouldn't just tell them their results and send them back upstairs to their unit. I would tell them this is how you go about this to get help for, hepatitis C, or this is the case management department that you can, seek resources from and, can get you help linkage to care. When I was diagnosed, there was none of that. It was none of that. I definitely want to see that, going on in the treatment facilities when someone comes back and they find out that they're Hep C positive or any diagnosis, talk to them about what it is and talk to them about linkage to care and how important it is, and that you can get treatment, you can get the help you need.
And it sounds like not getting that information really was a barrier to you engaging in care at that time. Are there any other barriers that you think people who use drugs experience related to getting treated for hepatitis C?
The stigma. When you walk into a professional setting or a healthcare setting and you have to tell the doctor that you are in recovery, that you use substances or you have used substances in your past, you definitely get a different treatment. Basically I was brushed off, basically told me that at that time that there was no damage to my liver, and just the way that I was kind of dismissed like I still didn't get no answers, you know? So like that's a major barrier. I just wish, honestly, I wish that question was off the table for the assessment. I wish that question was off the table, because if that question was off the table, I feel like they would get different, you know, care of treatment. Like I get that, like there needs to be, I guess, some type of data on how people contract hepatitis C, but then at the end of the day, then there also cause some barriers by healthcare providers. One of the main barriers is transportation. And I'm not gonna lie, like if one of the barriers is that you don't have a ride to get your labs, I want to make sure you get your labs. It's a major barrier. If you go get tested in the hospital and you found out you had hepatitis C and they're like, you have to go to this doctor's appointment over here, you need to get your labs over here, and you know, you have to pick your medication up over here. You're talking to someone that has no access to transportation and limited funds. And when we opened up the clinic here, I knew that when we get them patients and they're like, yes, I want this treatment, and you know, I call them, you know, and I'm like, you know, you have lab work, and I always ask them, is transportation an issue? And they're like, yes, it is. And I was like, you know, let's set up a time so I can help you get that lab work done. Let me know your appointments, because I want to make sure, you know, that nothing's going to stop you from getting your treatment. So, and then like the ideas for testing, I think, you know, screening through, you know, primary, you know, the primary doctors, which I think they do now. Automatically, if you go into a treatment center, I think you should be screened. I think you should be educated that there's this medicine and there's clinics. I have like this big idea, like, you know, as far as intake and into residential treatment centers, like we need to hand the pamphlets out. We need to let them know, like, if you're positive for hepatitis C, you can give this a call. Like, let's treat them while they're in treatment centers and educate them. So, like, you know, if they go out and, you know, if they slip up, then they're educated on what to do and not to do. One of the barriers as far as our homeless population, I had this story yesterday. We had an EMS call to this homeless guy, and he apparently has something wrong with his hand. One of his fingers was amputated, and he think his hand was broke. And they wanted to take him into the hospital, and he said, I can't go. And they're like, why? Well, this guy has a dog. And so he's like, but I'm really hungry. And he was like, I could have used some food. So I got his number and I called him, because I have resources to bring him out food. And I said, hey, you know, I'm gonna bring you out some food, some gift cards, and bus passes. And I said, you know, but I'm really concerned about your medical condition. I said, why don't you tell me what's stopping you? He's like, well, I have this dog and I don't want nothing to happen to my dog. And I was like, well, you know, I have an extra vehicle. I said, you know, I went out there and met him and his dog, and it's a very nice dog. And I said, if I pick you up and I put your dog in my vehicle and I take you to the hospital and we make an appointment to get your hand checked out, and I go out there, you know, sit in there, if I could do that for you, would you seek medical help? And his answer was yes, absolutely. And, you know, we talked about the homelessness and the insurance for him. And, you know, it's easy to get online and help someone apply for insurance. I said, we can take care of that. We can take care of that. Let's work on one thing at a time. And that goes back to like Hep C treatment. There's so many barriers. As far as like homeless people, you know, with the medicine, you know, we can give them lockbox. We can give them, you know, the bags with the locks on it to keep their medicine in it. And, you know, I've been back to the camps. And, you know, this guy that I seen yesterday does not have a substance abuse problem. And that's the thing, like the stigma on the homeless population and the treatment that they get and his traumas. So, and I don't have any ideas on how we can, you know, I would think I would deliver them medicine every day, but then I would burn myself out because there's so many back here. Yeah. But how do we keep them from losing their medicine, you know, when they're constantly being relocated or pushed out of a wooded area?
Yeah, it sounds like so many issues and it's so complex. And one of the things I've heard you talk about over and over again is the stigma around hepatitis C. and you shared your experience with stigma. What do you think we can do to reduce the stigma around hepatitis C for people who use drugs, and so that they are more willing to engage in treatment for hepatitis C?
Well, for me, it would have been more helpful, instead of him telling me, hey, I can't treat you, maybe he could have provided me with other resources or other providers that would have been able to help me, since that, he couldn't help me. So when he just shut me down like that, I kind of figured it was substance use or the liver damage. If I go into the hospital and I'm really in pain right now, and I really need a narcotic to ease my pain, if I go into a hospital right now and I tell them, I have a substance abuse history, they're not going to be so willing to give me a narcotic. They're not going to want to listen to me because of my history. And I think, I really don't have answers, but, I don't think that providers should base someone's medical needs on their drug history, because it's stopping them from getting the treatment they deserve.
You are completely right, Alicia. You are right. And in terms of places where people who use drugs might find it easier to feel comfortable getting treated for hepatitis C, what kind of places do you think we should be providing hepatitis C treatment? I know, we have the specialist centers, we have the hospitals, but what other kind of places do you think hepatitis C treatment should be made available so that people who use drugs find it easier to get the treatment?
So here, we have a shelter up here. And we have a lot of people that use the substances that go there to sleep at night. And also they can get showers and stuff every day. I would love to see a clinic set up there. I would love to see testing set up there, because that's where most of our people that use the substances go to take showers, or when they're ready to lay their head down for the night, that's where they go. Most likely they're going to walk into a program like that than a professional setting. I mean, we do get people here because of harm reduction, but we're not reaching out to all of them. And I just find the shelters and programs in the community, nonprofits, they reach out better to people that uses and the homeless population.
That's great. And what about treatment in drug treatment programs?
So we have like a few. The thing is, our treatment centers, their staff are burnt out. The thing, what I noticed about large residential treatment centers, the staff are overworked, they're burnt out. One of the things we tried to email the director and the case manager, and we don't even get an email back. And I'm like, my idea is like, okay, well, I know the staff members, my friend works there. So what I'm going to do is see if I can come in there and set up a table and speak as a presentation, or like set up an activity, like go down there and do like, a spa day with the woman. And then we can carry the message of why we're doing a spa day there as self-care and to treating our bodies right. And that would be my idea of things on how to get in. There's like, if you can't get in that way, let's go in this way. So
those are fantastic ideas, Alicia. And I love the message you keep sharing with us, that it's about the whole person, right? It's about taking care of your whole self and having the tools available for people to be able to take care of themselves, both in terms of reducing their harms from substance use and getting whatever treatment they need for whatever ailment they have, with hepatitis C being one of those. Thank you so much, Alicia. This is fantastic.
All right, thank you.
Thank you, Alicia and Sean, for sharing that conversation with us. And thank you for listening. Look out for more episodes in this series at clinicaloptions.com/hepatitis.